This is Michele Hughes from Ageless and Timeless, brought to you by our two wellness sponsors, Water and Wellness and European Wellness. Water and Wellness is your go-to supplier for purified water products and nutritional supplements that they manufacture, and the nanotechnology products from Dr. Chris Shade's Quicksilver Scientific. I have used these cutting edge products like Quinton and glutathione and can say that without reservation, these are some of the most efficacious products available. The Water and Wellness website is www.waterandwellness.com and their phone number is 877-296-6880. And if you use the code AGELESS for a 20% discount. European Wellness, founded by the iconic and widely published Professor Dr. Michael Chan, is the world leader in stem cell and peptide therapy, with 26 medical and aesthetic spa locations primarily in Europe and Asia. Their website, www.europeanwellness.com, details the wide range of wellness products that can be ordered using the Ageless code for a 10% discount. They will also offer our viewers discounts on medical and cosmetic services and products if they choose to visit the clinics. I have firsthand experience using their wide range of science-based stem cell and peptide products and am now a loyal customer. Go to their website, www.europeanwellness.com, for more information about this exciting company.
My love for you is immeasurable. My respect for you immense. You're ageless, timeless, lace and fineness, your beauty and elegance.
Hi, everybody. This is Michele Hughes from Ageless and Timeless, and I'm coming to you today from San Francisco. And my guest is a very esteemed plastic surgeon, and I have to always correct him or me about the terminology for cosmetic versus plastic. So we're going to talk about that in a moment. But his name is Dr. Paul Chasan, and he is in Del Mar, and he's going to tell us about his clinic, which you can see on the screen here, Ranch and Coast Plastic Surgery. There's good old Paul, looking really handsome. And turns out, the little small world thing, that Paul's brother and I have been friends for 15 years, and his brother is Mark Chasan. And he and I both agree that Mark is a Renaissance man, but he and I just have had such a great time hiking together and doing all kinds of fun dinners and so forth. So we're really, really old friends. And I don't want to use the word old, but we're friends. So that's how I met Paul. Although I haven't met him in face to face, I have heard so much about him from his brother. So Paul, welcome to Ageless and Timeless. We're very happy to have you here today.
Well, thank you for having me. I'm at your disposal. So
Good.
I'll let you lead.
Okay, well, there's a few things that I want to first clear up that terminology, if you wouldn't mind, because I know a lot of people have difficulty with the difference between cosmetic and plastic. So could you define that for us?
Yeah, without sounding too snarky, plastic surgeons most of us have either done a 5-year general surgery residency where, and then 2 years of plastics, then it's 3 years of plastics. And now there's integrated programs where it's either 6 or 7 years of plastic surgery, where surgery becomes part of your DNA. You take care of people in the ICU, you take care of people who are ill, you do reconstructive surgery, and you do aesthetic surgery or cosmetic surgery. So we're very particular and very proud of what we do as plastic surgeons. And when you finish, you're not just a beauty doctor, you're a real doctor and you're a real surgeon. And then you have to do a written exam, which is not just an easy written exam. It's a lot of people fail. And then you have to do an oral exam. So it takes years to become board certified in plastic surgery. So when you go through that pedigree, and then other people call themselves cosmetic surgeons, where who knows what training they have. There's no standardized training a lot of people who are retired anesthesiologists or emergency room doctors, or, they call it functional medicine doctors who do inject Botox, or dermatologists who call themselves, all this whole group calls themselves cosmetic surgeons. And you can get you can just pay and become part of this cosmetic surgery board. So now you're a cosmetic surgeon with really no surgical skill sets and no real sets in dealing with outside the realm of doing procedures. So when we hear cosmetic surgeons, there's just, we're not the same. And so that's a big thing for us.
Yeah, no, I can understand that. So what are the societies that are the most prestigious to be a member of once you are certified as a plastic surgeon?
Well, we have the American Board of Plastic Surgeons, okay? And that's encompasses if you're a board certified plastic surgeon. There's the American Society of Facial Plastics. And so if you went, and there's one other track you can go, that you can go into, be an ear, nose, and throat ENT doctor, finish that residency. Some of them do an extra year of fellowship and become a facial plastic surgeon. That's a legitimate way to go. And that's about it.
So you're saying that you can be a plastic surgeon and then go and get further training just to do facial plastic surgery. But if you, go ahead. I'm sorry.
So let me back up. Yeah. All plastic surgeons are trained in facial plastic surgery. Yeah. Facial plastic surgeons are trained in facial plastic surgery, where once they do a 1-year fellowship, a preceptorship in facial plastic surgery, but they're not trained to do any of the breast and body and all the other things that we do. Yet we're trained in face. Now, I'm going to, I don't want to belabor this point, but it is an important point that aesthetic surgery is a lifelong journey for a surgeon. When you finish your residency, you are not competent. Or barely competent to be a good plastic. Whether you do facial plastic surgery route, or the plastic surgery route, and the word general plastic surgery, the word facial plastic surgery, it doesn't really matter. It's your own personal journey to do this. So when facial plastic surgeons finish, when plastic surgeons finish their residency, they may have seen 10 noses, may have done 1 or 2 noses. If I were a patient, I wouldn't want someone coming out who's done 2 noses. Do you understand? Right. And it takes hundreds of noses to get good at noses. I've done probably 1,500 noses. So the issue is that becomes a personal journey. I have plastic surgery colleagues who are great plastic surgeons, but they only do 1 nose every other month. You know what I mean? So it becomes this personal journey that people don't realize that just because you're trained, I do about 3% of what I was trained to do, and the rest is on my personal journey.
So tell us about that personal journey. Go back in time and flash back to what was it that drew you to medicine first, and then to surgery, and then to plastics?
Well, when you're a young man, I don't think you really know yourself all that well. I wanted to be a pilot, and my mom, who was an attorney, said, "You're not going to be a pilot. Eastern Airlines just went out of business." She goes, "You're a pilot for 20 years with Eastern Airlines. They go out of business because they have bad management. Now you're looking for a job. You're going to be a doctor." That was kind of it. I mean, and my dad was a doctor. And so I kind of had my route chosen somewhat for me. But then going to medicine, it's a vast range of what you can do in medicine. I was an athlete. I was thinking orthopedics. I want to do something fun. And pretty soon you make that, there's a bunch of, I guess, in the algorithm of life, there's a bunch of decisions you make. Like for me, I would be on a rotation medical school and seeing old vets in the hospital and, coming in with liver failure, heart failure. That wasn't exciting for me. It was, but what was exciting? Trauma was exciting, and the blood everywhere and doing surgery. And that seemed to draw me in. And I started doing big cases. And so vascular surgery and the bigger cardiac surgery. And I was thinking that I was drawn into that. And then you start doing cases and you realize that, like in general surgery, I would stay up when I was a young medical student to do my first appendectomy, in the middle of the night. But then after you've done 10 of them, you start kind of getting bored because it's the same surgery over and over and over again. And I liked vascular surgery because they're really big cases, and you made a big impact on people. The problem is then they go to the ICU for a week because they're so sick, and you got to take care of them for sick. So it's kind of selfish reasons. But then I got into plastics, and we were doing big impacts on people. And one day we're doing a facelift, the next day we're doing breast reduction, next day we're doing breast reconstruction, next day we're doing a nose. And so the variety, and every case is different. It doesn't matter. Every time I did 2 noses today, guess what? Every time I do it, I've done 1,500 of them. Everyone's completely different. And
sorry to interrupt, but this is so fascinating. But there's always a specialty that every plastic surgeon I've ever known has always said, "Oh, I love doing this more than that." So what's your favorite?
Okay, so you back up a little. We only do 12 surgeries, in aesthetic surgery. When you think about brow lift, upper eyelids, lower eyelids, nose, facelift, breast augmentation, breast lift, breast reduction, tummy tuck, liposuction, you get pretty good at all those. That's it depends on your personality. Either you want to master every one of those or you don't. And I kind of like mastering every one of those. But to get back to your question, the things that I really enjoy doing are noses. I would say noses are the thing that I'm very passionate about. Revisionary breast surgery, I've been passionate about that for many, many years and written a lot of the early papers in our peer-reviewed journals on revisionary breast surgery and facelifting, facial rejuvenation. So if you say, what are my passions? Facial rejuvenation with facelifting, brow, eyes, all that you have to do together. Noses and tough revisionary breast surgeries.
So Paul, how much does psychology play in your decision to accept a patient, and what kind of questions would you ask a patient to be sure that they would be the right patient for you?
So like anything in life, 95% of people I deal with are normal people, and it's the 5% that occupy about 90% of your time. And it's hard to dissect sometimes. There are some red flags for me. You want to make sure they're doing it for the right reasons. You do surgery and stuff makes them more pretty, doesn't make them a happier person. If they have a deformity or they're aging and it's appropriate, most people are perfect. Like I said, 95%. What are the red flags? Red flags to me are someone who, believe it or not, is a silent pauser. If I'm in a consult, and I've done thousands of consultations.
Uh-oh, what happened?
That's a silent pause. That's really irritating. And that's not normal. And so if I'm in a consultation and somebody does that to me, that's not normal, right?
Right.
And I know that that's not normal. And so silent pausers, the know-it-alls, I've been doing this 26 years. I'm a 60-year-old man at the peak of my career, and somebody's going to come in and, if they are over, then they over-talk you and they're a know-it-all. Sometimes you kind of have to take a step back. Then there's the person who has unrealistic expectations. Those are somebody who will look on the screen and look, well, my neck isn't that bad. I'm like, well, your neck is every bit as bad as that, maybe worse, or they want this mole off right here or some small deformity, yet their nose is like hanging out like that. They're just not realistic. So, when you've done thousands of these, you kind of know what people should be saying or doing or looking. And so consequently, those are the things that I start taking deep breath and wondering if they're going to be a good patient. I would say to you that I have to take all those things within the context of some people are just nervous before surgery, and they can be bitchy to my staff. And some of these people, they're bitchy to my staff and they're just nervous about surgery. And then afterwards, they're the best patient imaginable. And it is a tough, you're right, it is a tough thing.
Right.
And you're dealing with I see people very intensely with, they're having their nerves for surgery. They have, they're really not, they're not in their best, right? When they're having pain, so yeah, there's a lot of psychology in it.
That's what I thought. And so in your mind, how do you define beauty?
That is something that is different for everybody. Two people can come to me and they want different things. Over the years, I think beauty there is this difference between what I think is beautiful and my art form and what that patient wants. And sometimes I'm not the right surgeon for that patient, right? And so that's why we have galleries. I tell people, look at my gallery, and if you like my art form, then I'm your doctor. Do you know what I'm saying? So if you are interested in a facelift, if you're interested in nose or whatever, look at my gallery and see if I'm your surgeon artist for you. Because what my version of beauty, I think, appeals to a lot of people, but it doesn't appeal to everybody.
But you must have evolved this over years of experience. So what you said you've been practicing for all these years, but what you were in the beginning is certainly not what you would be today because of all the experience that has come in between. So, I would imagine the definition of beauty changes, and also the population has aged. We're in a demographic, you and me, and not Tony though. Tony's just a little boy, but we are in a demographic where we, where we are in the largest cohort,
yes.
Right?
Yeah.
So as we age, do we change our perception of beauty? Because now we're dealing with a couple of detractors called aging. One is the aging, and then of course the other is the media perception or hype about what beauty is, and that's usually synonymous with youth, right? So
well, I'll give you a couple of action facts, or things. I mean, today in social media, everybody photoshops their pictures. Everybody's great lighting, and it sets up this unrealistic expectation of symmetry and beauty. It just does,
Right.
And a lot of women are like, why can't I look like that? I said, that person doesn't look like that. Or even when you get older, like Brooke Shields had, when she was beautiful in her youth, with the thick, low eyebrows. Well, guess what? That doesn't, as the skin ages, and that doesn't look good on a 60-year-old woman. It doesn't. And the look of a 60-year-old with that is different. And even in her, it's different than it was when she was in her teens and 20s.
So what you're really saying is, you, like we talked about it, the psychiatry part of this, that you actually have to be a guide to a patient about expectations, because if they're unrealistic, or if they're using that example of a Photoshop picture in social media, then they're just programming for disappointment. And you could be a rock star walking on water, and you're not going to ever satisfy those people. So this I think it's pretty fascinating, actually, that not only do you have to practice and be expert at your craft, which is very technical and precise, and of course takes years and years of experience, you also have to get inside the mind of the patient that is potentially could be a problem if their expectations are unrealistic. Well, so I think
what you're saying is 100%, and that's why, like, a guy like me who's been practiced 26 years, by any metric I'm the busiest guy in San Diego in aesthetic surgery. I'm booked for 2-3 months. I don't need a case. I just don't need the case.
You can turn them away if they're not the right case.
I can do the case I want to do. I think a lot of patients, not all of them, most patients appreciate my experience and my ability to say to you, hey, no, you're barking up the wrong tree. Or, you know what? I know you just came here for your facelift. You should do your nose. You should. I said, you know what? And you know what? 9 out of 10 will say, I appreciate that. That's great. And 1 out of 10 will say, oh, he's a jerk. He told me I needed my nose. And I'm like, hey, I'm being honest. And some people will look at their face and say, I just want this done. And I'm not pushing. I'm trying to create a finished product, either eyes or mini lift or a nose or a lip lift or any of those are just products to creating beauty. And so you can't, it's kind of like looking at a car and you have a dent in your back fender and the rest of the front has some scratches and stuff. And they say, I just want to fix the scratches. I mean, you can't,
right.
You got to look at the whole package.
Right. So you're saying the big picture. So what in your experience of 26 years, what has been the most spectacular outcome you've ever had?
Wow, that's a hell of a question. Okay, so on breasts, I had one lady, friend of mine actually. She had breast cancer. She went to one of the local hospitals here, and a younger plastic surgeon did her reconstruction, and she was admitted to the hospital 18 times with an infection. In fact, let me see if I can I click on something and show you?
Absolutely. Yeah, you can do that.
You asked me that, but let me show you something that's pretty cool of what I do. So this lady, can you see what I'm doing? I'm not very Zoom savvy. Can you see what I'm pointing?
No, I don't know. I can't see anything. Tony, are you there? No, he says, no, we can't either.
Oh, okay. I don't know how I would.
I know I get on these Zoom calls and people are doing all these PowerPoints, right? Yeah, I don't know how you're asking me. I'm not the right person, but Tony, right. Are you able to guide us, Tony, how to do
You have to share your screen.
Can I do screen sharing? How would I screen share with you?
You'll just have to, you have to just click screen share.
Where would I click that?
When you pull up your
screen share. Host disabled attendee screen share. So your host disabled attendee screen share.
Hold on. Let me give you access. Hold on.
Okay, so I'll show you.
Okay, now you should be able to.
Okay. Am I screen sharing? So
by the way, while we're at it, Tony, may I just tell you, you have the wrong name on the screen. I don't know if that's going to affect anything, but you've got Francis Cameron, and it's Dr. Paul.
Oh, that's
Chasan,
on his. That's just on his Zoom.
Okay.
Okay. I see, because he's using. I got it. He's using. Got it. Okay. No worries. I just want to be sure we didn't have the wrong name for our guest.
Are we screen sharing? Yeah, it has that's my associate.
Yeah, now I understand.
He's 36 years old, and I had to use his computer to do this.
Okay. I was just worried. I was worried when I saw it that we had he had the wrong guest. So okay, we're good. Okay, great. So I'm still not seeing anything, Paul.
I'll try it again. Let's see. Let's click this screen share and share desktop. What I would screen share, right?
Yep.
And share. And let's see, it says open system preferences.
Oh, you may have to change a preference to.
Oh, he may have that pre-programmed on his thing.
Yeah. Huh.
Well, that's okay, Paul.
You can actually send pictures. Maybe we can insert them.
Yeah, if you could send a picture over to me. And I can,
because I'm on his computer. Actually, we'll just go with what we got, and if you guys can figure it out, great. I'll show it to you. Anyways, she ultimately, very beautiful lady. Ultimately, had all these infections, and I said, I am your friend, and I think you should come and see me. But she was going through insurance, right? And eventually, the one breast extruded out, and she had a gnarled mess on her breast. It was this gnarled thing, and this is a beautiful lady, likes to dress sexy and everything. And it took me 4 stages: fat transfer, expander, implant, and now she liked fairly round, large breasts. And when you see her from before to after, it you can if you want to punch on, you might be able to go onto my website. It's on my website, but it was a salvaged her whole social life. I mean, she had a massive deformity, Or what I see a lot of is Middle Eastern girls who come to me with their moms, always with their moms, and they're in their 18 to 22-year-olds, and bright, outgoing, beautiful girls with huge noses. And, they've developed their skills, and they haven't relied on beauty. And then you do a nose on, you transform them. I mean, it's like a transformation. So that's really fun for me.
Mm-hmm. And so now let's ask the opposite question, which I assume you would expect. What was the worst outcome you've ever had?
I would say the worst outcome, I don't know. That's hard.
That's good. That's good that you have to think about this, because that means
I mean, you can't do plastic surgery and not have a complication or some things like that. I've had things bleeding where, once in my practice, I had to have someone go to the hospital and be admitted to the hospital because they bled so much. I've been thousands of cases. Yeah, you have nipples that can die. You have a guy who you do a facelift on, and on the fourth day he's chewing gum like this. I'm really chewing. He goes, "Oh, that's my Nicorette gum." I go, that you signed like 14 different consents not to have tobacco, right?
Right.
He lost. When I say lost, the skin died right here and here. I mean, I'm like, you're an idiot. I mean, just about everybody knows that you're not supposed to smoke or have nicotine, because the Nicorette gum, the nicotine in the Nicorette gum is the same as smoking. And we have it, in bright, bold everywhere. And so then, I had to let it heal. And then later on, I had to take them back about a year later and, elevate the skin and pull them back to get rid of those areas that have been depigmented and, scarred. And so, that's the kind of stuff we see. We do see
right.
that. Fortunately, it's not too often.
So when you're thinking about your practice and you think about the pros and cons of what you do, what is it that keeps you going? I mean, you obviously love what you do. You're obviously a part artist and actually a craftsman, because you're building. It's like me, I'm a developer. I build houses, but you rebuild people's bodies and faces. So it is a craft, right? It has a lot of
components of both. And some things are more craftsmanship than art form. Like, for example, a tummy tuck isn't a huge amount of art form, but it's very craftsmanship, because you see, right on the table, if the incision looks crooked, you see that. Or they have a big dog, you see that. And you can either choose to fix it right then on the table, make it perfect. You can do that. And that's craftsmanship. That's why, like, that is craftsmanship. Facelifting, it has some art form, but it's more craftsmanship, because you're doing the same surgery. You're just making sure that the earlobe is in set perfect, that the tragus, this part looks great, that the sideburn isn't pulled up, the posterior hairline here, they can wear their hair up. That's all craftsmanship. Things that are art form, noses are pure art form, because you can change a nose, the shape, the appearance, everything. So it does have craftsmanship, but it's very artsy. And so lifting is also another art form, because you can change how it looks based on how much you're taking, ups and downs, and you still have the craftsmanship. So your different parts of your brain, I'm really tuned to that. Different parts of my brain are working in different parts of the case. Like sometimes I'll say, okay, I'm done with the art form part. Now I'm in the craftsmanship part. You know what I'm saying?
Absolutely. And so have you studied art as part of your education in undergraduate school, or even as you later in other ways?
It sounds like a good story. And there's a lot of plastic surgeons who kind of make a marketing of that they're an artist and that they will be able to, that they draw pictures and they do all these. I've really not seen one of them who I really like their art form as on surgery. So, it's kind of funny. It sounds good. I'm a surgical artist and here's my art, but no, it's something you develop over many years, and you develop a sense of what is beautiful, and that becomes part of your palette and part of your DNA. And so some people appreciate that. And I do have, I have 6 other plastic surgeons who work here. And, one of them's my generation. And, we do things quite differently. We really do. We respect each other. We do things quite differently. And sometimes a patient will say, well, why should I go to you or should I go to him? I say, why do you go to a different restaurant? Both top quality restaurants, they do things a little differently.
Mm-hmm. So when you're in your private moments and you're thinking about the things that you are passionate about, what about your craft? And I mean this in a very blunt, honest way, but what inspires you? Why do you keep going? Because you've done this for 26 years and you obviously very well received and successful, and you've cornered the market in San Diego. So kudos to you, but you had to go through some moments of self-doubt, and I'm not trying to be a shrink. I'm just asking you, what in those private moments, what do you worry about and what inspires you the most?
Well, I'm just built a certain way. I've always been that guy who's always kind of push, right? And I've always, I'm just built like that. And so when one of my friends did a residency, and he was a junior resident to Mehmet Oz, and Mehmet is a phenom. Mehmet, when he was a resident, he had medical students following him. He wrote tons of papers. He's one of those guys that sleeps 2 hours a night. He's very effective and and my friend Mike said, Mehmet, why do you do what you do? And he says, Mike, I have one speed, full speed ahead. And I'm kind of built, not to say I'm in Mehmet's, class or anything, but I have one, I'm full speed ahead. And at 60, I'm at a place in my life where I've really nailed it. I mean, every surgery I do, I have it mastered. Every move I make, I feel like I'm very confident in all the things I've tried, every technique imaginable. I do about 2% of what is trained. I've written papers. I try to innovate. I try new things. I'm always trying to look over my shoulder. How can I do it better? And in fact, it's kind of fun when one of my colleagues, the one I was telling you about, who we do things differently, when he started, he does surgery at my surgical center. And about 3 years ago, he would come in my room and look, and we discuss stuff. I do it this way. We've been in our own silos for 20 years. And I'd go and look at him and see if he's doing something different than me. And, it's really exciting to hone your skills. And so some of my colleagues at my age are starting to think about, well, I'm going to slow down. I want to retire in 5 years. I kind of feel like I'm just getting started. I feel that's how I feel. I'm just getting started. And, to have a mastery of an art form like this, to just not, be involved and passionate about it, just seems odd.
Well, you are in your prime, and when you look for a plastic surgeon, you're always looking for those years of experience, and you don't want them to be too old where their hands going to be shaking. Yeah. but you want them to be, that 26 years is like gold in terms of your resume, your credentials, because like you said, the more you do, what do they say about the 10,000 hours, right?
Yeah, that's right.
Yeah. So, and I believe in that. We've all tried different things in our lives, not only our professional, but avocational. And we know that practice makes perfect, right? So the more you do something, the better you're going to get at it. And,
there's no question. For example, do you want a cardiac surgeon that does a bypass every week? Or do you want someone who's doing, 20 or 30 a month? You want that guy. And, I always tell, the patients, my surgical assistant, she's a Hispanic lady. She says, lo barato es más caro. It's the cheaper it is, the more expensive it is. And I tell patients, like when it comes to aesthetic surgery, you don't want a discount. You don't want discount neurosurgeon, do you? Do you want to discount parachute? No, you don't want to discount aesthetic surgery. You don't.
Right. So how do you feel that you got to be the best plastic surgeon in the San Diego area? Because obviously you have a lot of competition in Southern California and a lot of great doctors there. So what is it that has allowed you to pass those other surgeons and become number one?
Well, there's a personality to this. You know what I mean? There's some people, why is some guy like LeBron, the best basketball player. If you have a passion for it, you know what I mean? I have a passion for it. That's it. And I'm into it. I'm always reading about it. I'm looking at it. I'm trying to be better. If you make that as your, in any field, right? If any field that you have someone who's always trying to be the best in their field. And, you know, if you look, I've written more papers than, you know, in peer reviewed journals than any of my colleagues because I'm in it. So, you know, is that, you know, I'm a workaholic. I like it. I'm okay. I have a pretty good balance, but I do like what I do. And if you're passionate about it, I don't care what field you're in. If you're a chef and you're what makes a guy at the French Laundry, why is he such a great chef? Well, probably he has the same driven passion that I got.
Mm-hmm. Yeah, well, there's been so many books and leadership and entrepreneurialism and the role of passion is like the core. It's like the hub of the wheel. Yeah. If you're not passionate, you know what they say about what you believe you can achieve. So if you don't have a belief in yourself, and that's at the core, that what you're doing is bringing you joy. It's not just, this is not a job. This is like you said, this is a passion. And well, so who inspired you? Who motivated you when you were coming up through the ranks?
You know, I have had several surgical mentors. Some mentors taught me everything not to be. I was in practice with one guy. My first start, I was in practice with a guy for 2.5 years. He taught me everything not to be. You know what I mean? I watched him. I'm like, I don't want to be that guy. I just don't want to be that guy. There's, you know, over the years, you try to learn everything from everybody. You know, if, like I said, if you're looking always over your shoulder, how can I do better? And you try things and you do things and you see some people and you see their work. And every once in a while you go to a meeting. Most of the time I look at their work. I go, well, I mean, I wouldn't show that. Doesn't look good. And then once in a while you see somebody and you look for pearls and you say, wow, that's really good. I'm going to read everything I can about what that guy's doing. Or I'll visit other plastic surgeons. But at this phase in my career, I've kind of done all that. And I know what everybody's doing out there. And I've kind of you develop your own style. And you've, you know, made the mistakes and you know how to stay out of trouble.
So let's talk a little bit about health and wellness, because, you know, you're operating on people that some of whom are compromised, and particularly with COVID now, I mean, there's a lot more scrutiny of the immune system, but how do you I know you do blood work, but how do you make a decision about whether someone is a good enough risk to operate on based on what you see in their profile? I mean, as far as their overall health?
Well, you know, anesthesia, what you're really asking is an anesthesia question, because, you know, when you operate on someone, they should be able to handle that without, you know, any issues. If we have certain criteria, if they're on diuretics, we have to get lab tests. If they have a history of anemia, we get, you know, blood count. Anybody over 55 gets an EKG. If they are on multi-meds or they have any medical issues, we have to get preoperative clearance. Today, our anesthesia, and we use the anesthesiologist from our local regional hospital. We have modern anesthesia machines. And I would say that when you have a safe, you know, we have our facility, I think, is second to none. And so, and you have create a safe environment like that, most people do very well. We don't have like anesthesia issues. Anesthesia is very safe. Statistically, you're much more likely to get in trouble getting in your car and get in an accident than you are with anesthesia. And especially when I've handpicked these anesthesiologists, which the least experienced one has had 25 years experience, you know what I mean? And they're going to the hospital and here, so they're seeing the sickest of the sick patients. I feel very comfortable with that. So what I would say is that corollary to that question, what can you do to become more healthy for your surgery? And I, you know, cutting into people for a living, you see how their tissues are. And, you know, obviously youth is huge, right? But as you get older, I see this big disparity on jocks. People who do cardio have way better, noticeably, palpably different tissues than people who don't. Now, I do see genetics as a huge play in this, but you can maximize your genetics. So there's 5 different skin types I deal with. I deal with Celtic, the blue-eyed blonde, thin skin, bad sun damage. I deal with Mediterranean skin, the Southern Mediterranean, South American, Hispanic skin, Asian, Arabic, Persian, Middle Eastern skin, and Black skin. And they all have their own different things. Like, for example, how much Botox do I do on Asians and Blacks? None. It's all Celtic, because their skin, the lighter the pigment, the thinner the dermis, the more the wrinkles show through on muscles of animation through the skin, more sun damage they have. Those people tend to need more facelifts and breast lifts and tummy tucks, but they also heal really well. The white skin also heals very fine lines. Mediterranean skin is probably really good for everything. It's good elasticity. It heals well. Does great. Asian skin, great for breast augments and lipo, horrible for breast lifts and tummy tucks. They tend to get thick scars. Black skin is the best for everything. The best elasticity. I can do liposuction on a Black person and get fantastic results, where in a Middle Eastern person, that skin will just hang. Middle Eastern skin is the worst skin I deal with. Why? It doesn't have good elasticity. It takes forever for the scars to heal. So most people's scars, they look good at the first month, then second, third, fourth month, they're kind of red, and then there's a process, they heal. Middle Eastern, I tell them it's 8 months, 10 months, or a year before their scars look good. So, knowing that, I can kind of help coach people and tell them what the normal processes are.
That's very interesting. I never have heard that by an ethnic disparities. So that's really fascinating. Well, Ageless and Timeless, you probably saw a little bit on my website, but basically what we're doing, our purpose and mission is to look and feel our very best as long as we are alive. And so it being the best version of ourselves. And so, of course, and I told you right when I first talked to you that I've never had a doctor, a plastic surgeon, and it's like a big void that we had for so long. We've been doing this for, I guess, 15, 16 months now. And so I'm just so happy to have you on, because, a lot of people say, oh, I would never have anyone cut into me. But this day and age, it's so safe with what you just said. And so, you sometimes it's just not enough you can do with fillers. You know what I mean? And so the fact that we can look and feel our best by doing a little bit of, let's call it nip and tuck, or however you want to say it scientifically, that I think I think you're doing a huge service. It really is, like I said, it's psychological. The difference that you make in people's, the way they view themselves, by having a successful surgery is life changing. So
I would say to you that, I'm seeing even more than ever now, people in their 70s having new relationships. I see them, having sex where, the pre-Viagra days, that just didn't happen. Dating, enjoying, traveling, they're vibrant, they're working out, they're doing, like you say, the best version of themselves. Yet there's just nothing you can do against gravity. They need, facelifting, breast lifting. They want to look their best. They feel sexy. They want to feel sexy. Well, you can't feel sexy if you look in the mirror and you don't look sexy. You don't look your best, and you don't like the way you look in the mirror.
Yeah, so that's self-image. I have a lot of friends who, they're younger, they're in their 40s and 50s, but they're going through this self-image thing where they're starting to feel or see the signs of aging, and they don't know what to do with it. They're trying to find answers. And sometimes they find the wrong answers, like you said, so you have to do the corrective stuff. That's something I did want to ask you, though, as well. I'm glad I thought of this. Is that how often, like you told me about the lady with the breast cancer and how you helped to reinvent her, but do you find that taking on someone else's mistakes is a really dangerous protocol for you?
No, I have a whole practice of it. I love it. Are you kidding me? That's what I love doing. I love taking on major disasters. I mean, that's what I do. Thinking outside the box, using all those years of experience to do that. You see that show Botched? Yeah. That's what I do. That's what I do. I do it, I think, at the highest level that can be done. That's so when you say, hey, one of the things I really enjoy doing is revisionary breast surgery, the ones that have been done 4 or 5 times, or revision noses, the ones that have been done 2 and 3 times. And, you know, a lot of times I'll open up a nose. It's kind of like footprints on the moon. You can say exactly what that last guy did. And you go, oh, he's just inexperienced, or didn't do enough here, didn't do that. And, you know, you fix it and you say, hey, listen, we fixed it. And these people who went from really sad and depressed to and something they hide to something that they're proud of. And it is socially and psychologically improvement, much more than people give it credit to. There's always going to be the people who are negative on plastic surgery. You know, that I can't control that or fix that, but I can tell you that I do enjoy doing that transformation on people.
Mm-hmm. Well, that you are very unusual, because I hear a lot of this. I won't take a patient who has had a botched job because I don't want to be associated, you know, with that botched job. So they're basically running away from the challenge. What you're saying, you open your arms and welcome it, because for you it inspires you, right?
It totally does. In fact, you know, it's kind of weird how some surgeons are. I mean, I see people from all around the country, and you know, sometimes they need a follow-up with a plastic surgeon in their city that they came from. So a lot of plastic surgeons won't see anyone who they didn't do the surgery. I'm like, really? Like, if somebody comes here and asks me, hey, I had surgery somewhere else, and can you take out the sutures? And, yeah, of course I'll do that. Why wouldn't I? You know, but I don't know. There's egos and weird stuff going on in people's brains that I don't get.
Well, I think and that in itself gives you a niche. So I think you should be certainly promoting that. So that's the last question I wanted to ask you. So, well, no, I have 2 questions, and then we have to close. Run out of time. It always goes by so fast when we have people like you. My one question is, if you had a superpower, and I'm thinking, because you do have a lot of power, but if you had a superpower, what would that be, and how would you use it?
Well, I've thought about that. I think I'd like to know what everybody's thinking. That way, if I'm playing poker, I already know. And I wouldn't call certain hands. No, I don't know. That's a funny question.
Okay, so you'd like to be a mind reader, is what you're saying?
Yeah, mind reading would be a pretty good superpower.
Yeah, I'm with you on that one. I feel that way a lot. But okay, and then the last question is, what do you see in your future? In other words, where you are today, 26 years of experience, you've got a good, how many more years do you feel you're going to practice?
It's hard. I see a lot of my colleagues are aging, and they practice until their mid 70s. You know, I have a surgical center. I have a junior guy. It's not that I think I can practice another 15 years. I think what I'd like to do is, probably another 5 years doing just what I'm doing, and then probably just doing the same, but take more time off. I have 2 young kids, a 10-year-old and a 13-year-old. I kind of want to travel. I have kind of a wanderlust. And so I still want to do what I'm doing, but maybe, you know, do Europe for 3 weeks. It's something I can't do right now, you know.
Right.
That's kind of what I you know, come back, operate, instead of operating 3-4 days a week, I can operate 2.5 days and just slow it down. But I'm not going to do that for about 5 years.
Well, and not only that, but with COVID, you can't even get on a plane and go to any place other than the US at the moment. So, well, okay. So how would our viewers find you? Would you give us your quickie contact? I know we have your website. We'll have your website up on our...
Yeah, Wayne Coast Plastic Surgery, or just Dr. Chasan, Paul Chasan. You know, in today's world, you know, when was the last time I handed out a business card? You know what I mean? Just look me up. I'm in Del Mar. You know, if you look up plastic surgeon Del Mar, I'll come up. You know, I'm not hard to find. And so
I agree. But so if our viewers were coming to you, would they get some kind of a consideration for their visit, their consultation? And maybe
you want a free consult. I charge $150 for a consultation. If they come to the show, then I would probably waive that fee.
Oh, that is so sweet. Well, I wasn't trying to frame you. I realized that, normally, this is funny because normally I ask that question on the preview before we get on the air, but
well,
remember,
the consultation, we don't get rich off the consultation fee, but it's a natural selection. In other words, if somebody, I'm at the higher end of what I do and I charge, I'm at the higher end of what we do. And you can get that result. But if they don't understand that and they're not willing to pay $150 to see me and the experience I have to offer, then they're not a good patient for me. We're just not a good coach, right?
Yeah, no, I know a lot of the surgeons do the 150, but then if you do the surgery, they put a credit on or something like that.
Yeah.
Yeah, but thank you for that offer, because we always like to give our viewers some special VIP thing that, and also, we want people to know that you are the choice we made. We didn't just say, Ageless and Timeless is going to have 10 plastic surgeons. No, it took us 15 months to have one. So we had to wait for the right one, and we had to be very sure that the right one is the one that we want our viewers to know about, particularly if they live in, I'm assuming you have patients from all over the world, but if they live in Southern Cal, of course, it's going to be a lot easier. So, all right, well, Paul, we have to close now, and I want to thank you so much. We do a little bit of a closure from just my little monologue, but you can stay on with us if you would like. So thank you so much, and I hope I get to meet you. I do have a girlfriend, I just spoke with her today, who goes down to Del Mar from Las Vegas every summer, and she said, why don't you come and visit me? And I said, well, I have two reasons for doing that now. One is you, and the other one is the man that's going to be on my podcast today. Awesome. So hopefully I'll come and have we can have a lunch together or something when I'm there.
That'd be great.
And that'll be probably in July or something like that. So do you work all summer? I assume you work.
You got to give some heads up. Okay.
Yeah, no, of course. I'd always tell you I'm coming. All right. Well, thank you again. So to our viewers, I think you have heard a very accomplished plastic surgeon today that is anybody's guess would be to put him at the top of your list if you're going to be looking for a surgeon. I'm not trying to sell him. I'm only trying to tell you based on the facts. I've done a lot of research. I may be a little biased because his brother is my friend, but I did get that intro. But then I went and did my own independent research. I wouldn't have invited Paul if I hadn't come out of that with flying colors as far as his capability. And he has a lot of very happy patients. So have a look at his website as he just gave it to you. And if you're wanting to make an appointment, be sure to use the Ageless name, Ageless and Timeless, so that his office knows that you're coming through this podcast. Okay, well, thank you very much, Paul, and you have a beautiful evening. Take care.
Okay, you too.
All right. Okay, bye-bye. Bye-bye.
My love for you is immeasurable. My respect for you immense. You're ageless, timeless, lace and fineness, your beauty